Welcome, everyone. We are so excited to have you join our session today. We've got a panel assembled, and we are going to be talking about re-engaging and the support of members in the new post or current COVID environment. We are going to be talking about how in this new realm we are meeting the members where they are. So my name is Kim Barrus. I am the Director of Clinical Outcomes Management at SelectHealth, which is a health plan if you're not familiar. We have a great panel assembled for you today. Our panel members include representation from health plans as well as other healthcare supporting organizations. This will be great for the topic that we have today. The variety should provide some great insights into the different ways we can all consider approaching the support of our members in this new post or current COVID environment. We have some prepared questions today that we will go through, but we would love to invite you to add any questions that you have into the chat. I'll keep an eye out for those and make sure those questions get answered. And I would love to turn the time over now to our wonderful panel and have them give an introduction of themselves. We will start with Christine.
Hi, I'm Christine Leo. I am Vice President of Product for Cigna for the Medicare segment, which includes Medicare Advantage and Medicare Supplement. I'm based out of Philadelphia, and I am thrilled to be here with you today.
Thank you, Christine.
My name is Louise Briguglio. I'm the Senior Vice President of Experience at Icario Health, which works with some of the country's largest health plans. And we reach out to members to engage them in care, complete HRAs. My personal background is in experience design and human-centered design, do a lot of behavioral research, so this is a topic particularly near and dear to my heart. I'm based here in Minneapolis. It's very chilly today.
Thank you, Louise.
Hello, I'm Dr. Nathan Estrada. I'm the VP of Clinical for Nimble Science. We're an older adult engagement platform to improve balance and to decrease fall risk at scale, and I'm based out of Denver, Colorado.
Thank you.
Hi, good morning. I'm David Kirkus, Director of Consulting Services at EnlivenHealth. We support clinical interventions, patient communications, and medication adherence strategies for health plans and retail pharmacies. I'm based in sunny Tampa, Florida.
Terrific. All right. Thank you, panel. We'll just go ahead and jump right into questions. The first question that we have for the panel is, what communication methods with members have you found most successful since the pandemic? Nathan, would you like to get us started?
Yeah, sure. I think that it's, first off, you have to have a multi-channel campaign, right? And that multi-channel campaign has to take into account the older adult preferences. So you're going to ask them, how do you want to be talked to? Some older adults actually want to be texted every day as a reminder of things, and it surprises me, some of their preferences. I think another aspect of kind of meeting them where they're at and being successful is really coming from the voice of building trust before we have an ask. Having a call to action and getting 12 flyers in the mail is too hard for an older adult to parse. And so just allowing them the autonomy and the preferential ability to dictate how and when you communicate with them is really kind of the key to the success. And we use every form of social media as well, and even communicate via Facebook at times.
Perfect. Thank you so much. Christine, would you mind going next?
Yeah, I have to agree with Nathan. Really multi-channel. We use all vehicles. Telephonic. We've had some great telephonic campaigns, particularly during the pandemic. We had some outreach where we had customer service reps who reached out, and a customer experience team who reached out to our members and sang songs with them, just, visited with them. We had people who actually asked, can you call me back on my birthday? It was a really great experience, and it created a great connection with the plan. It was great for the employees as well. It made them feel much closer to the work that we're doing and trying to do. We also use texting, email, but again, telephonic is probably the best touch point. Of course, everyone uses mail, but I've been in a meeting the last couple of days, and we've been talking about, sometimes people are getting, 8 pieces of mail on the same day from various vendors that we may work with. Just really thinking about and being thoughtful about how much we're pushing towards folks, and having a very coordinated and thoughtful approach continues to be important.
Christine, that's great. I think I want them to call me. Put me on your list. I think that would be
Okay.
great.
We will.
Thank you. Great. David, how about you?
Yeah, I think we found that a proactive approach is really key. And, patients want to be informed and don't want to have to search for information. It needs to be readily available, but in a way that is relatable and easy to digest. Totally agree that text messaging has been a very successful way of keeping patients informed and also serving up opportunities to engage them in their health. But it's got to be personalized and delivered from a trusted source to be effective as well. There's a lot of skepticism about messaging, unsolicited text messaging. So credibility is key. For instance, a targeted outreach to a member from the health plan or from a pharmacy, from a provider that is trusted, letting the patient know about a clinical intervention that's necessary is something very effective. And then we've seen a lot of success as well, linking from that SMS interaction to another very effective communications tool, which is chatbot technology. So chatbots facilitate an interactive and conversational digital experience to facilitate things like scheduling appointments, gathering information for patients, completing necessary documentation. So kind of taking that, tailoring it, making it a very personalized and interactive and engaging experience, we've found to be beneficial.
That's great. David, we do have a question in the chat for you from Hector. For texting, did your members have to opt in prior to first contact?
Typically, yes, there is an opt-in process to allow ongoing communication via text.
All right, perfect. And last but not least, Louise, how about for you?
I would just underscore what everyone else has already said, the importance of using multiple channels, using them in an orchestrated and fairly fluid way, understanding that not every member is going to engage with the first channel and not the, same channel over and over again. One thing that perhaps I could add, though, is we've seen a really interesting evolution also just in the tone and the way that members want to engage. David, you talked about trust. The nature of that trust has really changed. At the onset of the pandemic, it was a very acute thing. And we actually saw in a population that we don't always see this, a desire to have information from trusted institutions, right? Looking for that sense of authority, those institutions, whether it's a large health plan, whether it's frankly the government, saying, what is going on? Somebody get me the answers. It's changed though. And it's funny, this really actually mirrors what you tend to see with patients, right? And sort of different stages of perhaps a condition, right? The onset of the pandemic, it was almost an acute thing. Like, oh my God, I blew out my knee. I need somebody to fix this. And so the way you see people with that sort of acute injury want to engage with their provider is, I want somebody to come in and fix this. I want a trusted surgeon who's an authority. Maybe they work on some athletes, so they've got some star power. I want them to come in and fix me. And what you tend to see is as people have perhaps like a chronic condition, so something that they're managing over a long period of time, they start to become perhaps a bit more of an authority in their own state of health. You'll see them, instead of looking for almost a paternalistic or a maternalistic relationship with their authority or their information provider, they start to look for a true partnership. And that's kind of what you're seeing in the pandemic in terms of the kind of information that people want, the way they want to relate to their payer, the way they want to relate to their provider. They're saying, hey, respect me because I'm living with this day in, day out. I'm starting to think about risk. I'm starting to think about how I make decisions. And I want your help, but I want your help as a partner, not as an authority necessarily. And so that's been a really interesting shift to watch in people's behaviors.
Oh, great insights. Thank you for that. We do have another question in the chat that I'm just going to throw out to the panel. The question is from Megan. What has been your experience in standing up an enterprise-wide approach to capturing member preferences and email addresses? We don't want to ask for their contact preferences if we can respect. We don't want to ask if we can respect their preferences holistically. Sorry, struggled with that a little bit. I'll work on reading.
So
go ahead, Christine.
So I can start out. I mean, we ask for it. We do ask for it in enrollment information. We ask for email addresses. We do ask for preferences. How do you want to be communicated with? What's your language of choice? Those are things that are very, very important because, again, it personalizes it. It makes it easier if you're communicating in the manner that they most like to be communicated with, and also in the language that they like to be communicated in. So we capture that. We also, if someone does call into customer service, we do confirm that their contact information is still correct and ask to make sure that there are no changes in their preferences. It doesn't mean that we won't use other channels. We will continue to use multiple channels to reach out to people because I think, as Louise said, sometimes people's preferences change. They may start out with, hey, I want a phone call. And then as they get more comfortable, they may say, yeah, I just like getting a text, or I just like getting an email to remind me of something. So, again, multiple channels, but we do ask, and we ask it up front, but then we do ask it as we have interactions with them.
One thing that we found really impactful is to actually prep another communication with a different alternate channel. A great example of that is, hey, you're about to get an email that has your weekly update, but sending it via text. And allowing that multiple channel to go there to add trust and authority to another source that they may not use as frequently, that's a better conduit for information. You can't text an email. There's not enough space there. But you can use text to give validity and trust to an email and expectancy and excitement. So instead of someone reading an email and they go, oh, here's another one from Nathan, they go, ooh, I've been waiting for this. And it changes that whole personality profile. So it's important to not only think about what's the ideal channel, but what other channels can you tee up information with?
Nathan, I think that's a great point. We see that with some of our vended solutions. We may let the consumer know that you're going to get an outreach call from a vendor on a service because you've been recently discharged from the hospital. So they know to pick up that call and they don't miss out on that opportunity to get that really important benefit that's going to help them to transition from hospital to home, as an example.
Really good point, Christine. I love that pre-notification idea, right? So you're sort of building trust in the following communications. Another thing maybe just for our audience to think about is usually when you're capturing member preferences, at least part of the intent is to reduce abrasion on the member. To the point of the question, I want to respect what you've told me. I want to make sure this is a low abrasion experience for you. I would encourage people to maybe think about a couple other things too that we sometimes don't think about when we're thinking about preferences and abrasion. One is to really use your data, because it turns out you'll probably see what we see is that abrasion is pretty personal, and maybe you even know somebody like this in your life. So for example, my husband is opts out, right? If he's getting emails from somebody trying to sell him stuff, he makes sure he hits that do not subscribe list right away. I kind of just let it flow in. Sometimes I see multiple attempts to contact me. It's almost like it's a reminder service. So I have a very sort of very high abrasion tolerance. My husband has a very low abrasion tolerance. So to a certain extent, if you can start to use your data even to personalize a little bit, and maybe perhaps understand, are there segments that have different abrasion tolerance? If you can look at your data to see, are there segments that, again, prefer one channel over another, certain times of day, cadence tolerance, right? How frequently can I, or how much space between attempts? All of this, you'll find it really kind of varies for different parts of your population. So the underscore there is really taking a data-driven approach if you can. And so many folks do have access to really large amounts of data about their population.
Yeah, I think that's a great point. And, we've been solving communications issues for retail pharmacies, particularly for many years, and managing both inbound communication from patients into the pharmacy and then messaging out via a variety of channels. And the way that we've been evolving that personalized experience is actually, using a more data-driven approach to determine not only what channel the patient prefers, but the time of day that works better for them. When are they calling the pharmacy and most likely to be responsive to an outbound communication? So trying to deliver the message on the right channel at the right time and tailoring that experience to every patient's, the route that's going to be most effective for the patient.
All great insights. Thank you so much, panel. I'll move on to the next question. We've talked a lot about outreach and preferences, switching gears just a little bit to access and access options. What new access options, including telehealth, video, or other, have you been able to implement and sustain since the pandemic? How about Nathan again?
Yeah, it's actually been interesting. I think the key aspect for us is broadening the perspective of who's a healthcare provider. I mean, I can get 80% of a population to go get their eyes checked. Why would I not use that as a preventative health tool first? Because sometimes engagement begets engagement, right? Getting them to have a lower lift health behavior can drive higher lift health behaviors later. So honestly, I drive people to the pharmacist for medication reconciliation. I get their vision checked, and then I work on PCP visit. Because at that point in time, I have an engaged member who's had some success and they're winning in other aspects of their health life. And so I think that's what's been successful for us. And to really drive meaningful conversations, we're preparing the older adult for what they want to achieve to make sure that they get their goals met. You know, you go to an annual wellness visit, it's a checklist extravaganza on the provider side. Well, the older adult's consumer going, hey, these are the 3 things. I know you have your stuff, but here's the 3 things we're going to do today. And we found that that experience is far more productive and empowering than simply passively allowing people to schedule something in the future.
Nathan, that's great. I like they've already achieved a success in engagement. That's a great train of thought. Louise, would you mind going second?
Absolutely. So, on our side, we aren't in the space of providing care, but, many of our clients are. Like I said, we work with health plans. They often have care management solutions. And I think one of the really exciting things we found is that because they're often moving to digital solutions more and more, we're able to almost seamlessly connect the need or the demand with the resource right away. And I can't tell you in terms of getting all the way to that end goal of getting that person connected to care, how powerful that is to reduce those logistical barriers. Like, I gotta call somebody during working hours when they're available, or I have to find time for somebody to watch the kids so I can get in the car so I can go to the appointment 4 days from now. It's like anytime you break the momentum in that cycle, you're introducing a lot of barrier and friction into that experience. So because people have moved to sort of digital points of care, we can do things, sometimes it's even sending people to a behavioral health resource that's available 24/7. And so through a health assessment that we run, we can identify that need. We can get members that need to be triaged immediately right into that point of care. It's just, I can't tell you how exciting it is just from an engagement perspective.
Excellent. Thank you so much. I can feel the excitement, Louise. It's there. You can feel it. Christine, would you mind going next?
Yeah, I mean, we have gone down sort of a path. We're fairly far down the path here at Cigna where we have added a tremendous amount of telehealth services. They are not for everyone. We utilize MD Live for many of the services that we provide, but then we have other vendors that provide some therapy services, things that you might not think about. For example, virtual speech therapy lends itself very well to a telehealth space. Yes, the pandemic really, let the horse out of the barn, and I think it's here to stay. It's not for everyone, and it's not for everything. But you'd be surprised. My 92-year-old mother-in-law, hallelujah for telehealth, because she's got a lot of visits, and we're all her transportation. We need to get her there. So, she's very proficient using her iPad and getting on Zoom or getting on whatever the vehicle is to have that telehealth visit. And it's great for us because it frees us up as well. But we know that she's getting the care that she needs. So I think it's really, really been wonderful. Again, it's not for everything. You still, need to have some of those in-person visits. But I think to Louise's point, I think one of the areas where we've really seen a lot of explosion is in the behavioral health space. And it, I think, is going to really help people get the care that they need earlier, because what's more comfortable than having that visit at home, not having to go to behavioral health? It removes some of the stigma of going into that office. So I think that that's really important and will continue to be important as we move along this continuum.
Christine, that's great. I love the note that you add about the caregivers, right? And relieving some of the stress of the support for the members to get them to the appointments. That's a great acknowledgement and thing to think of. And your note for that it's not for everyone. When we think about this behavioral health that keeps coming up, I've heard from members, for some, if it's a particularly deep and stressful behavioral health, some of them actually feel more comfortable engaging in that visit if they can do it in their own space versus having to go to somewhere unfamiliar. So great points. Thank you so much. David, would you have anything to add on this topic?
Yeah, I mean, I think obviously, the expanded access to care that technology solutions have provided is a tremendous value. And, particularly when patients were afraid to go out, but could still see a physician, and we saw massive spikes in the utilization of telehealth. And that's come down to a new normal now that is probably going to accelerate again at some point as, more of those services are able to be provided through those channels. But, the other thing that we really have to consider is making sure that access to care is widely known in additional care settings as well. You think about, scheduled time with a pharmacist for a clinical intervention is a new concept, really, that wasn't widely adopted until the pandemic. And there was this need to vaccinate millions of Americans and do it in a way that didn't lead to long lines in the pharmacy and mass congregations of folks indoors. But patients are historically accustomed to that type of setting in the pharmacy, but now can then go ahead and schedule time with a pharmacist for a vaccination or a COVID test, a treatment, or other clinical interventions, which is great. Access to care at the pharmacy has really improved as a result of the pandemic, with broadening scope of practice for pharmacists. And patients are largely comfortable visiting their neighborhood pharmacy. It's typically more convenient and a less expensive site of care than other settings as well.
Oh, great points. Thank you, David, for adding that. We do have a question in the chat that I'll throw out to the panel. This is from Vicky Lowe. What would be the recommended route when a member can't or doesn't want to do an e-visit or go into the office because of COVID?
I mean, phone calls, right? I mean, you look at that, we put this artificial constraint that you have to see someone to engage with them productively. I would say that having a phone visit is a universally appealing option, and sometimes we add more tech than is needed in that interaction.
Excellent. Thank you, Nathan. Other panel members?
Yeah, I would agree with that. I mean, we still have the challenges of, CMS gonna continue to reimburse for phone or not. But to me, having at least a phone call visit is better than nothing. And maybe during that interaction, you can appeal to the consumer. Maybe they can't do an e-visit. Maybe they don't have internet. And, we hear that from people that is a challenge. There is the digital divide. But maybe you can say, we will schedule you as first patient of the morning or at the end of the day. My husband's a practitioner, and we're in Philadelphia. He has one patient in the office at a time. He's a dentist, so there's a lot of aerosols, so, a lot of concern. But that makes people more comfortable. So if they understand what are the logistics of the office, and that can happen, again, just telephonically having that conversation.
That's great, Christine. That's something that we had to work on, especially for mammograms for us. That was a place where they were particularly not feeling safe. And so making sure to share and make visible and transparent all of the work that was happening to make sure that the center was safe and scheduling space was safe. Other thoughts or ideas from the panel before we move to the next question? All right, we just have a comment in the chat from Deanna. Unfortunately, phone visits do not count for risk adjustment. We have a provider practice that would take an iPad to the parking lot for patients to use. That is an innovative idea, Deanna. Thank you for sharing that. All right, panel, we're going to take another turn. Please, this is a fun ride, right? So we're going to switch gears again. We've talked about outreach. We've talked about access. I would like to spend a little bit of time talking about social determinants. So what social determinants of health are proving to be the biggest issues for our populations, and how are you working to overcome those challenges with the pandemic? How about Christine, would you mind going first?
Again, I would say social isolation continues to be one of the biggest challenges that we deal with. We have implemented some new products this year, again, along with our customer service and customer experience outreach, where we are teaming up with a company that puts people out in the community to interact with seniors, to interact with our customers, and to, do some light duties at home, maybe helping them with their technology, maybe helping them, maybe taking them to the grocery store, maybe playing games with them, going for a walk in the park. Again, in the pandemic, it has been a bit challenging because, again, if you've got folks who do not feel comfortable having someone come into their space, hopefully they can develop a relationship with someone. That creates a challenge for us, but that continues to be a challenge. And I think will continue to be, will be a challenge for us going forward, even as we come out of the pandemic. As people age and they become less mobile, they tend to, a lot of times be more isolated. Maybe they are losing friends. Maybe they don't have a lot of family close to them. And, social isolation is the new smoking. It's the equivalent of smoking 15 cigarettes a day. It has significant health impacts. So it is really, really important that we pay attention to that. So anything that we can do, even again, if it's telephonic outreach to these folks regularly, if you can stand up customer experience teams that do some of that, or even, I think, David, you brought up, chat bots. There are telephonic services that, could actually have an interactive conversation with you that sound very, very real. So, I think those are all things that we're going to all need to be looking at. If you've got vendors who are doing things like, say, delivering meals, they have an opportunity to interact with people and at least give you eyes and ears into what's going on in that household to determine if you need to get out there. It's going to continue to be a challenge. It's a behavioral health concern. Again, it is a greater medical concern as well as we age.
Thank you, Christine. I'm going to give us a little time check real quick. We're down to about 12 minutes. We'll finish the round with this social determinant question, and then we do have a couple of other comments and questions in the chat that if we have time, I'd love to address. David, thoughts on social determinants?
Yeah, I think Christine's point was great, and I do love the thought of using a digital engagement to sort of, beyond just gaining trust, but having that sort of automated communication that it shows that the organization, the healthcare team cares about the patient, wants to know what's going on, and it is facilitating a solution. I think, again, when you look at social determinants, ultimately you're identifying what the barriers are to patient access and care. So, I hate to keep going back to it, but just reiterating that knowledge of the expanded access to care, whether it's through electronic means or in the pharmacy or other care settings that are a little bit less traditionally, top of mind when a healthcare event occurs, the more that you can do as an ongoing education experience for the patient, facilitating their knowledge of where they can turn for help is very critical as well in dealing with social isolation and other issues.
Thank you, David. Nathan, would you mind going next?
It's really interesting. When we look at it in Colorado, only 12% of older adults say social isolation is their number one concern on the social determinants. Food insecurity is actually 45%. And so what we found is that the people that are socially isolated, it's a real issue that needs real intervention. But we have some broader issues. And that food insecurity happens all the way up to $50,000 of annual income. So you look at that, and what we've really found to be interesting is we wonder more on the social determinant side is, are we leaving people out for two main reasons? Number one, rural Americans don't have broadband, which leaves them out of a lot of digital health solutions altogether. And so we need to stop requiring broadband for interventions, or we're going to struggle. The second aspect of that is we have to be reverse compatible with devices that are 7 years old, because those are the devices sometimes in these people's houses. And so if we as a digital health company really want to address social inequity, we have to be widely available with low broadband connectivity with older devices, so we're not leaving a whole cohort of people behind.
Very good point. Louise.
I guess I would just kind of piggyback off of what Nathan was saying. So similar to what everyone else has said, in terms of, barriers, and we actually ask people, what's preventing you from being able to take action or do this thing we've been talking about. And a lot of it, very similar to what we saw before the pandemic, food insecurity, cost, transportation issues, but the biggest swing is in things like broadband access, to Nathan's point, is feeling like there's these things now that they need to be doing that they can't because they simply don't have broadband access. I love what Nathan's talking about. There's actually a concept in user experience design called graceful degradation, which means, right, you can design for someone who has broadband access and a newer computer, but what happens if they don't? And what happens if they don't have the next thing you want and the next thing? So essentially, anytime you're designing experience, you need to think about what are the alternative options so that it can degrade gracefully and people can still get the same quality of experience. Another tactic, a different tactic that we're taking on the same note, though, is that we're working with actually some partners and a client to actually have our client think about offering broadband access as a benefit, or subsidizing rather broadband access as a benefit. So there are some folks who are looking into that as well, is how can they help their members with some of the infrastructure that they need.
Oh, those are great. Thank you so much for sharing. I'm going to take us to the chat, and I'll read both questions that are there in the chat. We're down to about 8 minutes, and I know we do have another group right after, so we need to finish on time. I'll read the 2 questions, and then if the panel would just like to respond to either or both. The first is from Shari. In response to the awareness of benefits comment, aside from mailings, are there any other recommendations to help members become more aware of special benefits? The second is from Ashlyn. Follow up on the first topic, as more members are replacing landlines with cell phones, have we experienced challenges with telephonic engagement when caller ID isn't displayed and the incoming phone number is unfamiliar?
So I'll take the second one. From my own experience, yeah, absolutely. If I don't recognize the phone number, I don't answer it. Louise, I think to your point earlier, I have a low abrasion tolerance, particularly with my cell phone and people calling me. And so I think it's really important that that we identify ourselves. I get it. A lot of times we're using big call centers, and so those numbers don't come through. I think also with pushing a lot of our workforces to home, people may be using, they may not be using a company phone, or it may not come up as a company phone, but we need to be able to identify ourselves, because I think it's making it challenging for us to connect with folks. And then you leave a message, or maybe they call back, maybe they don't. It's a missed opportunity, huge missed opportunity.
Yeah, I agree. I think I kind of touched on this earlier with the skepticism that people in general have with receiving unsolicited calls or texts. So I think partnering with someone who can send a phone call or a text message to a member on behalf of a trusted entity, a provider or pharmacy, so that that you have instant credibility when the call or the text message comes across. I think really is what I've seen is the best way to overcome that particular issue.
Can I take the first one?
I'd love you to. Thank you, Nathan.
So when you look at that awareness of benefits, I think we look at it from the wrong direction. In other words, we're always trying to figure out what we want an older adult to do. I think we got to start with what are their life goals, because no one has a healthcare goal. They have a life goal. They want to go to their grandson's wedding. They want to do these other things. And we should be attaching those benefits to achieving their life goals. And as a result of that, we can't tell them what to do, because no one does what they should. They do what they want. I think the second aspect of that is, when you're talking about benefit education, we should start with benefits that remove barriers, not solve our problems. So reminding them that, hey, we're going to pay you to do this visit. There's a car waiting to pick you up, right? And we've removed this friction points for you, and then offer the benefit. So de-risk it, allow them to tell how this impacts their life, and then get your needs met. But that requires us getting out of our own bodies and going to the older adults' needs first, and that's where we win.
I like that, Nathan. Very patient-centric, patient journey, right? We hear a lot about that. I think that's excellent. Louise, something to add?
Yeah, I would just build on that. I think, Nathan, that really, really resonates. And, I will say we have seen huge success when we're interacting with a member, when we really start by just talking to the member about their goals, right? And sometimes their goals can be, do you wish you had more energy? Do you wish you got better sleep? Kind of starting with those things that all of us could say, yeah, actually I could. Because members don't walk around thinking all day necessarily. Certainly some are in the unfortunate situation where they're really thinking about their health all the time, their healthcare all the time. But for a lot of members, you're not walking around thinking like, oh, here's my risk score, and here's what I need to be doing. So kind of just saying, is there something you'd like to improve? And then tying some of the things that you want them to do to their own goals, right? So earlier we talked about the importance of remembering someone's preferences for, text message or email. I would say perhaps one of the most powerful things is if you could remember their goals. And so if what you can do is you can actually tie their healthcare journey back to those goals that they've given you, that's an incredibly powerful experience that really creates a lot more action when you're not contextualizing the things that you're recommending for the member.
I think that's great. It kind of takes us back full circle to the beginning about that personalization, right? The more we can personalize to the member, the better connection we're going to have. We do have a couple of notes in the chat that I just would like to share. Roger added a comment for us. This is called motivational interviewing for the consumer, right? That's great. If we have just a couple of minutes here, we're down to 3 minutes. I would like to invite the panel. Is there, when we pulled the panel together, I'm sure there was something about your group that you would like to share about this topic. And I want to make sure that if we haven't had a question opportunity for that to come out in the last 2.5 minutes, is there something that anyone from the panel wanted to share that we haven't had a chance to hit yet?
I just want to elaborate a little bit on what Louise and Nathan said, and it's really, yes, understanding the customer's goals, but also, vehicles. You don't just use mail to communicate benefits. Use your providers. Make sure your providers know what benefits you offer and what value that helps and how that helps them in their practices. And, use your care management teams. Also, use your sales force and your brokers so that they can, they're closer and probably having those conversations that are, a little more meaningful than just somebody getting a piece of mail. We're still going to do the mail, but, again, saying, hey, you get these great meal benefits, or you have a fitness benefit. Yeah, you're getting ready to go to a wedding and you want to look your best in 6 months. Get out there and get fit. We've got a great dental plan for you, whatever it is. So I think that's really important, to use all of those resources to get out and get the word out.
That's great. Thank you, Christine. Other comments from the panel that you wanted to have time to share?
I think the only thing that I would add is we have an interim mantra at Nimble that joy plus entertainment always equals sustainment. And so you have to look at, is this interaction actually bringing joy to someone's life? And that should be the primary driver of communications, which means that telling someone they have a problem is not joy-filled, but telling them what they can do about it is empowering. So taking an asset-based approach rather than a disability-based approach. And I would always encourage people, add value before you call to action. Give people value in that interaction before you ever tell them all the things you need from them, or you're not going to get the motivation on their side.
Excellent. Louise or David, any final comments?
The only thing I would add is that, we live in a world with a very short attention span. So we're all constantly bombarded by information from every angle. And when it's, I think a lot of that targeted messaging gets lost in the noise. So to beyond personalization, it's got to be very targeted, and the communication needs to be clear, concise, and consumable in quick and easily understood portions, so that it's not part of this information overload that we contribute to.
Thank you, David. That wraps up our time, and we have a next presenter right on our heels. So I thank you so much to the panel, and thank you for those who are able to join us today.
Thanks all.
Thank you.
Thank you.